Abnormal Psychology Lesson 5. And in Lesson 5, we are looking at psychotic disorders. Psychotic disorders. Uh, this information and this lecture is coming from the book entitled Abnormal Psychology, written by Dr. Tulipo Mwenifumbo. So in lesson 5, we are going to look at psychotic disorders, where we are going to give the definition and symptoms of psychotic disorders, and we are going to look at the causes and risk factors for psychotic disorders. And we are going to look at treatment options for psychotic disorders. This is your host, Dr. Tulipo Mwenifumbo. You can order some books, and also you can register in any of our programs. We have got different disciplines that we are offering, from bachelor's degree, diplomas, and certificates. So you can contact me by giving a comment, or you can also WhatsApp me on +260 18 12 56 +260 976 18 12 56. Let's dive into our lesson today, and I want you to listen up to the end, and you should also like the video and leave a comment. That's the way you can be able to support us. What's the definition of psychotic disorders? When we talk about psychotic disorders, we are talking about a group of mental health conditions characterized by a disconnection from reality, often involving hallucinations, disillusion or delusions, and disorganized thinking and behavior. So this kind of illness, it's comes from where people now begins to hallucinate, where they begin to they are disconnected from the reality, and they begin to uh, dream, or to hallucinate, or to think delusionally, whereby they cannot think properly. They begin to talk about something which is not a reality. The symptoms of this kind of mental illness, which is psychotic disorders, as we say, there is hallucinations, that is perceiving things that are not there, such as hearing voices and or seeing things that are not real. So hallucination, it is the situation where a person begins uh, to say, I'm hearing the voices. Oh, I'm seeing this. There is somebody who is doing this. No, somebody wants to kill me. What? So that is what is called hallucination. So it's a mental condition, a mental illness that is characterized, or that is characterized in what is called psychotic disorders. Then delusions, this is believing things that are not true, such as being persecuted or having special powers. Delusions are, it's a situation whereby somebody begins to believe things that are not true to be true. No, I'm being bewitched. Yes, the people are bewitching me. Not that this person is seeing, or there is, he just believe that there is something that is happening, or I'm being persecuted, people hate me, and uh, or me, I've got powers to destroy anybody. they begin to live in the world which is not a reality, and they begin to see negative things, and they begin to imagine negative things. The difference between delusions and hallucination. Hallucination, it is they see things which are not there. Delusions is they believe things which are not true and which are not even there. Then the third symptoms is disorganized thinking. That is difficult organizing thoughts and expressing oneself clearly. Um, you find that a person's mind is very disorganized. They are not thinking properly. They cannot bring themselves together in uh, coming up with constructive thinking. So that is disorganized thinking. Then there is also disorganized behavior, difficult performing daily tasks and maintaining relationships. Um, It is also a psychotic disorder where a person cannot maintain relationship, where somebody just see bad things in other people and they cannot relate with the other people. They only see negatives in relationships. It is also a psychotic disorder where a person mindset is not thinking light. Then there is the negative symptoms, lack of motivation, pressure or interest in activities. Also, there is it's a disease or it's an illness where a person just begins to it just creates negative thoughts about things. They cannot enjoy anything. They always see things to be bad. They always see um, things to be negative or things to be against them. So they cannot do anything. They cannot enjoy anything. Life has to them has just become so much a burden, and they just see problems everywhere, and they even where they are supposed to be happy, they are not happy. It is also a psychotic illness, which is a mental disorder. What are the causes of this kind of illness? Um, some of the people, it may be this recurs because of the family history. You may find that the families which have got such kind of illness, it may come, especially when in old age. There are people that there are some families that have got genes whereby psychotic disorders comes when they are old, when they're getting old, and also it comes sometimes because of genetic, whereby if anything disturbed, they begin to develop that. Then the brain chemistry, which is the imbalances of neutral transmitter, neurotransmitters such as dopamine and serotonin. This is also, it can be caused by where now the brain chemistry, there is disorder in the brain chemistry or in the neurotransmitter. So the way the transmission of neurons, they begin to not giving proper signals or information to the brain. As a result, a person begins to see things uh, in a disorderly manner. Then the brain structure, that is abnormality in brain structure, such as a reduced volume in certain areas. Others, they have got this problem maybe because the brain has got it's a biological thing. Maybe when they were born with some areas in the brain were maybe they are small, they are they are able to have the full function or full ability. So that begins to or create such a thing like those that are those that are born with uh, cerebral palsy. You may find that they may be hallucinating and they may be having such challenges, psychotic challenges. Then there is what is called environmental factors, which is exposure to stress, trauma, or substance abuse. Some it comes because of substance abuse, where when a person is drunk, they begin to see things which are not there. They begin to hallucinate, and sometimes when they have taken drugs, like they have smoked dagga, it creates that. And when it persists, you may find that this person is becomes psychotic because of drugs or because of beer drinking. The brain is somehow damaged. So then also there is stress whereby a person is has gone through a certain stress environment, and that environment begins to make that person for the brain to just to release itself. They begin to hallucinate, they begin to have the poetic, psychotic behavior because they want to cope up with life and they just can't cope up. So they'll begin to see things that are not there. They begin to uh, look at things which are not there. They begin to view things that are not there. They begin to see people that are not as enemies who are not enemies. As we say, the risk factors may be family history, having a first degree relative with psychotic disorder. So, a person, when you see a person has got this as a psychologist, you need to find out the from the family, do they have such a challenge so that you may know how to deal with such a problem. Then there is substance abuse, using of substance such as cannabis and other drugs which can also cause such an illness. Then trauma, that is experiencing traumatic events such as physical or emotional abuse. So those becomes the risk factors. So you need when you are diagnosing this as a psychologist, you need to know to understand the family history. You have to understand the substance. If this person is under behaving that because of the substance abuse, or you because of the trauma, or because of what they have experienced, then is it because of stress, ongoing stress, or significant life changes? Is it because maybe there is something that this person has gone through which has created that? And also sometimes it's a medical conditions. Maybe this person is sick or have a certain medical condition such as neurological disorders or infections. So there are certain infections, like I've heard about cerebral malaria, where a person has a certain disease and infection that may create neurological disorders. So those are the risk factors, and as a psychologist, you have to know the background of this kind of disorder and what is the cause of this kind of disorder. And the sixth, you have to look at the maybe it's exposure to some demonic challenges, demonic issues, where this person maybe has been practicing um, cultism, so spiritual or issues. So you should also consider that, is it spiritual? Is there anything that may have caused this person to get this kind of illness, mental illness? Is it because this person visited some witch doctors? Is it because this person uh, wanted, maybe thought, I'm going to become rich by doing this, and all those things? So such are conditions that you need to know as a psychologist. And what are the treatment? How do we treat people with psychotic disorders? Number one, there are available medications that can be used. There is the antipsychotic medications that can be help reduce symptoms of psychosis. So you, as a psychiatric, as a psychologist, you may refer these people to a psychiatric, so that the psychiatric may be able to apply what is called antipsychotics. And also there is mood stabilizers, medications that can help stabilize the moods. Then there is antidepressants, medication that can help reduce symptoms or depression. So these, as a psychologist, mostly you may not be licensed to give medicine. So you need to refer this individual to the medical practitioner or the psychiatric doctor or practitioner who may be able to apply this medication. Then this is where our major duty is as psychologists, to give what is called cognitive behavioral, which is psychotherapy. Psychotherapy, it is a psychological therapy that comes with what is called counseling, and also you do subsessions with this person in trying to balance up the mind of this person through different methods of therapy, like cognitive behavioral therapy. Then also family therapy, which helps individuals and their families cope up with psychotic disorders. So the family also can be involved. As a psychologist, you instruct or you help the family to cope up on how they are going to help this person, so that this person comes to the light mind and begins to think rationally. Group therapy helps individuals connect with the others who are experiencing similar symptoms. That is where now, as a psychologist, you bring these people and you are able to speak to them, give them the challenges on how they can respond. Why do you think you are seeing this? What could be the problem? So you you probe using the counseling therapy. Then there is also what is called life changes. Life changes can be whereby you just have to bring these people where they should do some exercises. Maybe when they just run, you just make them to do some exercises. I started observing this kind of challenge with my son. He always see people being against him and what. So what I started doing was to create some exercise sessions with him, doing exercises and training his mind, and also training his physical body to concentrate on himself instead of thinking about other people, and also to begin to think rationally. So I did this through giving this child exercises, making him to do some mental exercises and some thinking therapies. Uh, then sleep hygiene, it's also very important to create what is called sleep hygiene. So sleep hygiene, it's a person, maybe it is because of stress. So that is where now these people are even given something like Valium so that the person may have enough sleep. Then eating health diet also. There are other alternative therapies, that is mindfulness based therapies. That is where you help a person to focus on the present and relaxation, like the one that I'm saying that I used to help my son. Anti-art therapy, which is a therapy that involves using art to express emotions and experience. So you use some pictures and you begin to let this person begins to look at them. And there is also music therapy, whereby you help this person to play music, because when the music is being played, this person begins to concentrate on the music, and you may find that when the music is played, you may even start moving your body. So that also, it is a therapy that you can use as a psychologist. Just be with that person, begins to play music with that person, and that person, the music is going to express emotions and experiences. So depending on what you have diagnosed, which is the cause of such a psychotic behavior, so or disorder, then you can play music to help this person. Then there is also a spiritual therapy, whereby you can be able to help this person spiritually, for deliverance, or refer them to spiritual people who can be able to give spiritual therapy, and or through pastoral counseling, through other spiritual methods that can help this person. So there are varieties of ways that we deal with psychotic people. So it may be a brain damage, it may be maybe out of stress, which is psychological, it may be spiritual. So you, as a psychologist, you need to know and to understand what could be the cause of this kind of problem, this kind of challenge. So we have looked at psychotic disorders as complex mental health conditions that requires comprehensive treatment. Understanding the definition and symptoms of psychotic disorder, and also how you can apply the therapy by referring this person to the psychiatric practitioner, or you can use the psychotherapy, or you can refer this person to some spiritual therapists, or you can use what is called uh, other therapies. So you may, as a psychologist, you may apply different therapies and referrals to ensure that your client comes to the hearings, as yeah, to the mental orderliness. So you have to know that you as a professional, one of the things is that where you cannot work, or where you cannot do, you need to refer somebody. You should not be a jack of all trades. Thank you so much. As I've said, if you for you to get more information and for you to understand more about this subject, you need to order this book. You need to have, it's just a must that this you should have this book, because it's not only academically, but it can also help you in lifetime, because in this book also I've put in some of the uh, therapies, psychotherapies that can be used in handling these matters and these issues. Thank you so much, and God bless you. Let's meet in the next class.